Hi everyone, it's time now for Better Money, and Joel Johnson is a certified financial planner and managing partner at Johnson Brunetti. We're happy to have him here because as we approach retirement, understanding how Medicare works can really be crucial. So Joel, thanks for being here.
It's great to be here, and it's great to be here to clear up this subject. There's a lot of mystery around Medicare. A lot of people are confused until they get into it, but usually those few years before retirement, people know this is coming up. They've got to make some decisions. There's always changes in the law, and so it's really important that we cover this subject.
And so we have to ensure that you have the coverage that you need. So you say, number one, we got to enroll on time to avoid penalties?
That's correct. We have to enroll at age 65.
Okay.
The only exception to that is if we're going to work past age 65. But you've got to enroll at age 65. Even though that's not your normal Social Security retirement date, got to enroll at 65. Otherwise, there could be a penalty later if you enroll late.
Okay. And you have to identify what will be covered and what is not covered.
Exactly. Medicare is actually really good. Sometimes it gets a bad rap because it's a government program, but it covers a lot of great things. But there are some things it doesn't cover. There are deductibles, just like normal health insurance. So it's important people understand what's covered and what's covered, and they might want to buy what's called a supplemental policy to cover that gap. Some of the policies are actually called Medigap because they cover the gap of what's not covered in Medicare.
Yeah. And even if you do all that, let's say you know your Medicare, you get your supplemental, do you still have to plan for maybe out-of-pocket costs?
You really do. There's things that Medicare, for instance, Medicare does not cover long-term care. So if somebody has to go into a nursing home, unless it's from a surgery, they'll cover part of it, like if it's a rehab. Okay. But if somebody goes into a nursing home, like my dad did for Alzheimer's or something like that, or an extended care facility, they will not cover that. That's not covered by Medicare. People have to plan for it by setting money aside or by having some type of supplemental policy.
Okay, so to help you understand, you have a free offer. Everyone can get this for free. It's actually Medicare SSA. It's a booklet, and people get their free copy by just going to bettermoneytv.com. You'll send it out for free, and you'll even answer personal questions.
We'll answer every question. We've got experts on Medicare in our office.
Okay, so this is something you really need to start thinking about, especially if you're nearing that age 65.
That's correct, because there's choices to make what the best plan is for the individual. Everybody's a little bit different.
All right, Joel, thank you so much.
Thank you, Kara.
That's Better Money.